Hello, I'm Sir John Bell. I'm the chairman of Our Future Health. And I think it's a really important time to reflect on the impact that our future health is likely to have on our healthcare system, but also on the wider success of almost all global societies who are currently under pressure from a huge healthcare burden associated with the major chronic diseases. When we set up Our Future Health, it was intended to be the first global cohort of scale that would allow us to look at the way we can use prevention, early diagnosis, and early intervention to flatten the morbidity curve from many of the major common chronic diseases: heart disease, stroke, dementia, respiratory illnesses, renal disease, hepatic disease, obesity, diabetes, all the diseases which are so prevalent in most Western societies and which are becoming much more prevalent in developing societies. So that has proved to be the North Star for the project that we've done. And it looks now like we have got the numbers in Our Future Health data set that will allow us now to start to undertake the studies that are going to be necessary to understand how you do prevention and early diagnosis at scale in a population to make a material difference to the outcomes. So the next phase, and we currently have about 2.5 million people consented for Our Future Health, and we'll be headed for 5 million. We do want now to think about how we use the resource to interrogate the different interventions that can be used. We want to understand better how you can use a whole new set of therapeutic tools to manage disease before people become symptomatic. And that's why having a population between 18 and 101 is crucial, because we can find people who are just beginning to get the disease but don't have symptoms, and we can see whether the interventions are likely to be effective. Now, there's a whole host of new interventions that could be useful in this space. There's the usual methods for reducing serum cholesterol, for reducing blood pressure, but also the new class of drugs, the GLP-1s, that are associated with reduction in body weight and dealing with the overall problem of obesity. And so those, along with things like adult vaccines and other interventions of the kind, are likely to have a profound effect on our ability to increase health span in a population rather than lifespan. And that should be the goal, I think, of many of the things that we're doing. The other dimension here is to try and understand how we can diagnose many of these diseases earlier. So as we all know, diagnosing cancer earlier is the best solution to making sure that you can cure the disease. And there's a whole set of new paradigms that we can put in place to make that work. And we hope, alongside some of the exciting therapeutic developments, that we could get to a world where most people with cancer are being diagnosed when they have stage 1 or stage 2 disease. So this is an exciting possibility because no one else in the world has the asset of Our Future Health to be able to do those studies. And I think we're uniquely positioned here in the UK to undertake those studies and to see if we can change the whole way healthcare is delivered, now increasingly focused on prevention, early interventions, and early diagnosis of disease. That should make a massive difference to the health of the population at large, and also to the sustainability of the NHS. Thank you very much.